Today we will be talking about foreskin issues in adults. The foreskin issues in adult men commonly includes phimosis, a tight foreskin, and the paraphimosis where the foreskin is retracted and cannot be returned. The paraphimosis causes swelling of the foreskin, can be painful, and that needs emergency attention in the nearby casualty department. The foreskin narrowing, the phimosis, the tight foreskin can cause pain, difficulty passing urine, infections, complications such as inflammation, scarring, infections, skin conditions, and very rarely, the precancerous conditions can affect the foreskin. With the foreskin problem, the phimosis we're talking about, where the foreskin can be retracted but can be painful but cannot be returned to its original position. This can cause restriction of blood flow to the tip of the penis, can cause pain, swelling, and potentially tissue damage. Infections, sexually transmitted infections can cause this problem. Very rarely skin conditions like lichen planus, psoriasis, balanitis can cause inflammation, itching, redness, and giant wart can be there in the foreskin itself, causing this narrowing of the foreskin, which is very important. Bowen's disease, and very rarely other conditions that which can potentially lead to penile cancer. You should seek medical advice when you have narrowing of the foreskin, difficulty with cleaning, pain or discomfort during erection and sexual activity, and or inflammation. Now, there are treatment options available for narrowing of the foreskin, which is stretching exercises, topical treatment, surgical correction like circumcision very rarely will be necessary. Paraphimosis, which is the foreskin coming back and causing swelling of the foreskin, edema of the end of the penis, needs urgent medical attention, needing manual reduction, ice packs, surgery. Now, circumcision on its own can relieve most of these problems. It's considered the gold standard, and it can cause infection. Operation itself can cause bleeding, blood collection, cosmetic unsatisfactoriness, end of the penis could become numb, narrowing of the water pipe, meatal stenosis, scarring can cause very rarely pain, and some people might need revision procedure. There are different methods of circumcision. One of them which is advocated is called partial circumcision, which I describe it as removing the diseased part of the foreskin, giving an appearance of boiled egg on a cup appearance. It doesn't look like you've had circumcision, but by retaining foreskin, I retain sensation to the end of the penis, and also feeling whilst they have sexual activity is preserved. There are other methods of dealing with tight foreskin, such as trapezioplasty, which I do not routinely recommend. And if the frenulum, which we call it as a bonjo underneath the tongue, like structure is tight, then I offer frenuloplasty, which cures 2 out of 3 men very often. So on balance, there are definitive treatment options available for foreskin problems. Do approach me.